My question's for Dr. Gujar. So, you explained what your research is about injecting oncolytic viruses into the cancer cells. And would you be expecting similar outcomes in patients who are immune compromised and have a history of various autoimmune disorders and have a current ongoing episode of cancer?
Yeah, no, that's a very good question. Um, so to the first answer to answer your first part of the question, um, y- the so far the worldwide oncolytic viruses have been used for multiple different types of cancers. Almost you can name it and it works well. One of the best experiences that we have had so far using oncolytic viruses in people is that we haven't had almost any really bad side effects, because that is one of the things people always look out for when we're developing a new drug, because most likely if somebody is undergoing cancer therapy, you can tell by just looking at them, right? Like either they would be so weak, most probably they have lost their hair, or they just what we call like sick looking, right? So that's we know that these drugs are not really doing any benefit to their health or their overall health. So what we have seen so far is that in immunocompetent hosts, especially, the drug is very well tolerated. So you can imagine we have a mouse that is usually 25 grams, right? Tiny individual. We can put, in terms of virus particles, 10 to the 8 particles in that mouse, and it is still alive, right? So the virus is well tolerated, and it goes after cancer cells very selectively. So if you are a patient who has active immune system, you got no trouble. Now, going to your second question, whether it could induce the autoimmune diseases in individuals who may be a little bit immunocompromised. So far, we haven't seen anything really substantial to support that. That being said, the research is still on the go, because any time when we try to target anything related to cancer, it is so close to your normal self, there is always that possibility that something could get initiated that also targets your normal self. But so far, like I said, the one of the projects that we are working on, we are going after really 8 to 11 amino acid long peptides that differentiate your cancer cell versus your normal cell. So you are minimizing that chance of autoreactivity even further and further, so that hopefully when you go forward in few years, what we will have is combination of these small molecules that only happen in cancer, so that it is not producing any side effects in your normal cells. So that's the reason, so that we can avoid any possible autoimmune disorders while giving this treatment.
We have time for just a few more questions. Over here and then up there. Great.
Thank you. Hello, my name is Mireya. Thank you for everything today. And I just have same kind of topic of interest to ask a question, Dr. Gujar, about the viruses that are being injected into the cancer patient. Don't they get fight off by the immune system within 2 weeks or so?
Yes.
And how do you go from there?
Yeah, no, that's a very good question. If you're looking for a job, we have a job in the lab. Because that's very obvious and very good question. Because the question is that yes, you can use viruses to target cancers, but before your virus can do any good against your cancer, what happens is as soon as you put your virus in your body starts identifying your virus, and then it goes after virus before it can do its good deeds, right? So now we know that we can play that game with virus and cancer in a way that you use your virus as a tool to get your immune system going, right? So because once you can get your virus to train your immune system, which usually takes 7 days, if that immunization or if that training happens, you don't need that virus anymore. Okay, so I'm going to give you guys like a very simple example what we did just to explain that. We did a very simple experiment, right? So if you take a mouse or if you take any host, and if you had that host has a cancer, if you treat that cancer with reovirus, right? And the idea is that now immune system is trained. If you take immune cells from that host and put into second host now and try to give that host cancer, will not happen. That tells you that once your immune system is trained, you don't need, because the second host didn't get any virus. It only got your immune cells. So once you train that immune system, you don't need that virus anymore. So going forward, that's the idea, that these viruses, these pathogens, these will be used to train your immune system. We are not even looking at their capacity to kill the cancer cells on their own. It is a tool to get your immune system going so that you don't need them anymore, because you don't want to have virus in your body for the rest of your life anyways, right? And you want a treatment that happens in a small window of time, and then after that, you are protected by your own defenses. Right, so that's where the research is right now, that how do we implement, how do we use these viruses so that we can figure out different ways so that you can train your immune system, and now you are okay on your own because now your immune defenses are, because you can imagine, most of us, we got immunization when we were kids, right? And you never got those diseases, right? So if you really figured out a successful way of immunizing or teaching your body, that's the holy grail of treating this cancer in a natural, organic way where you don't have to rely on the drugs. And that would be the cancer immunotherapy.
Hi, and thank you everyone for the presentations. They're amazing. But I guess this one for Dr. Sarah and whoever wants to jump in. In terms of, I guess, health promotion, I suppose you're kind of speaking to the choir with everyone in this room who's educated and who's already bought into these treatments. Do you foresee like a difficulty in the future, and actually we're kind of facing it now, I suppose, with various movements of anti-vaccinations are back into the conversation, and in terms of, say, using your own immune system and viruses to treat cancers, it kind of lends down the same pathway. In terms of like public engagement, and even people and parents of these children that are maybe not so educated, do you find you're having more difficulty, or do you have any tips or anything along those lines, I guess, on a primary care level or practitioner level?
That's a really great question, and actually our secret weapon, I think, is the kids themselves. When you have children, and what we heard for example, when we were doing the H2K project, teaching kids about physical activity in the school, and one of the children said, my dad's a smoker and he has promised to quit smoking if I can run around this field however many times. That is, and we've seen this with children and youth. If we can get them engaged and motivated around something. We've seen this with climate change, which we're seeing very, that conversation now. We've seen it with recycling. And we did actually have also seen it with things like smoking in cars as well. So I think that is our opportunity, and particularly with Uplift, that's a big focus of Uplift is actually is engaging the youth and training the youth, if you like, to be leaders in health promotion and taking that message back to the community. And I'll give you another little example. I mean, this is again, my children are now 18, but when my son was in grade 5, and this is the work that I do, we have a school food nutrition policy, for example, that was in since 2006, but it has been consistently undermined by everybody, not just parents, but many people. Fundraising with unhealthy food still happens. And my son came home and he said, "Well, Mum, we're having a bake sale." And I said, "Ooh, well, let's do, granola parfait, yogurt and stuff, And he went, "Oh, Mum, don't do something too healthy because I'll be the only one that does." That's what I mean by things being abnormal. We've got to switch that around. And as I say, I think the kids are the way to do that.
We have one final question up there at the top, Joanne.
Danny, I know you're not excited about your research at all, and neither am I. But I would really love to hear a little bit about your work in women's reproductive health and the use of glass in uterine fibroids. As we all know, there's not a ton of research in women's health, and I really commend the work you've done there. And I'd like to understand a little bit more about how glass is used in uterine fibroids, what some of the side effects are, and if it's in practice now.
That's a great question. Thank you. So this whole microsphere story, when I came to Dal first and wanting to make microspheres to treat malformations and cancers, we actually started with considering fibroids. They affect a massive percentage of the female population. About 640,000 hysterectomies are going to happen this year in the United States, and the principal cause for those hysterectomies will be uterine leiomyoma. 80% of those patients, we estimate, are eligible for a minimally invasive treatment. A uterine leiomyoma can be as large as a watermelon for some patients, or as small as a satsuma or a grape. And you can have many or you can have one. But the uterus is an interesting organ because it gets lots and lots of blood supply from lots and lots of vessels. Uterine fibroids are really hungry for blood, and they tend to take their nutrient supply from just one vessel, the silly buggers, the uterine artery. So if you can take out the uterine artery, you can stop blood flow to the fibroid, which causes it to shrink and become asymptomatic, while maintaining the total patency of the uterus. The catch in doing that is you need a particle that's easily visualized under multimodal diagnostic imaging approaches so that you can see where the particles are distributed, so that you know they're targeting the correct areas, so that you're not going to do any damage to the uterus. And so we made a particle that is imageable on X-ray, CT, and invisible on MRI, because that's what the doctors wanted. Like, thanks so much. Make it visible on everything, but invisible on MRI. Right. But anyway, we made it. We got lucky. I wish I could stand here and say we engineered it and we know glass so well that we did that. No, we didn't. We engineered it and it was visible on X-ray and CT, and thank goodness it was invisible on MRI. But we made it, and we started that company, ABK, to commercialize that technology. And we have been working with FDA to bring that technology to the market right now, along with a radioactive version to treat primary liver cancer and metastatic colorectal cancer. I was down with FDA just a few months ago, going through the last pieces of test documentation that they need to see to release it onto the market. So we hope to have that technology launched in the next couple of years, ready to treat lots and lots of patients with fibroids. But it turns out that it's got really cool benefits for gentlemen with prostatic hyperplasia as well. And those gents don't have an awful lot of options. There's lots of meds and things like that available, but it is possible to go in and embolize the prostate, just like you'd embolize the uterus, and cause the hyperplasia to shrink, which ameliorates symptoms massively. So there's tons. I mean, it's very simple, really. You're just plugging a sinkhole with peas, right? But you gotta find the right vessel, and you gotta know that when you're putting a particle there, that you can control it, you can see where it's going, and that you can monitor it in the patient over time to make sure that the treatment is optimal and personalized to their condition. And that's where we're headed next. We now want to make those things so they degrade. We want to be able to go in, cause an embolic event, cause ischemia, cause symptom relief, and then have the particles disappear so that the patients don't have to worry about long-term exposure to medical devices.
So, Sultan, I'm coming back to you with my question. And you know what? If you don't want to answer it, if you want to give me another answer to something else, you get the last word. But here's what I was curious about. Can you share with us the impact your people has had? You know, the patient outcome, I guess, question. What impact, if any, has your research had on people? If you've got an example of someone who helped to drive your research, or the importance of why it has to be focused on the patients. Thank you.
Well, as I mentioned earlier on, your previous question, you know, we are right now at preclinical stages of this technology. And so our hope is that by developing methodologies where we can diagnose people more accurately, that this technology will facilitate clinical trials so that we can get better curative drugs. And I think that is not just true for the work that I do. I think that is true for all the medically related field and any field, where if you're able to develop a technology that can diagnose and help with early diagnosis, then it will facilitate finding a cure. So that's, I don't know whether I answered the question, but
I liked it. I liked it.
Could I just add something
Yes,
to
you
that
may,
briefly?
Danny.
Because it's a great question, and I often think, like, I'm primarily motivated by getting something to the patient to improve the patient's lives. And I kind of didn't realize the impact we can have on people's lives on that journey. It was like, because of those little glass microspheres, there's been about 30 really high-paid, fantastic jobs in this region that wouldn't have existed without that research. There's companies coming from California with mergers and acquisitions teams to little old Nova Scotia to take us out for beers to see if they can work with us and talk with us. There's people in university, undergraduate programs, getting training in companies like that locally. Prior to some of this research happening in the last 10 years in this region, people were just leaving. Now we're bringing people. I've recruited people from all over the world to Nova Scotia to come work here, work in my lab at Dal or work in the companies in the region. So definitely we're motivated to help patients, of course. I just didn't realize how much good you could do along that road as you're going to help those patients.
Local research, global impact. Aren't they amazing? They are fabulous. So, how many, show of hands, are in the health professions, either currently or graduated from or alumni? So this is, we're swimming in your lanes here. How many alumni from other faculties are here today? Great, excellent. And then the other category, not health professions, not alumni, you just learned about this and you wanted to come. Anyone? It's wonderful. So I get to work a lot with researchers and health professionals, and I'm just always amazed and overwhelmed by their presentations. I especially love it when they present with 500 slides behind them. And some of those slides make my head hurt, because I'm not one of you. I'm not a health professional or a medical researcher. But I just want to say a huge congratulations and thank you to the four of you. You can see why they've been chosen to speak today about local research and global impact. You are the best, you are a communicator's dream, is what you are. Speaking of local and a village, it does take a village. I was reminded last night I attended another alumni event put on the presentation, Edward Snowden, who was streamed in to us from Russia. And this is all part of Alumni Weekend. The village that has helped put this together is quite huge and hardworking, led by Alumni Affairs, the team as well from Advancement. We've got folks here from Communications and Marketing. There are folks here that are doing social media. We've got audiovisual experts. We've been provided catering by Aramark, the Dalhousie Medical Research Foundation team, and there are other volunteers that came forward to help out today. So I sure hope I've included everyone, and if not, I do apologize, but thank you all for what you did to put on such a great event.
All right, well, it looks like I get the last word. And again, so thank you to all of you. Thanks so much, Janet, for freeing your schedule to do this today. You did a fantastic job, and it's been amazing and continues to be amazing working with you. We have something for you and for our 4 guest speakers today. I want to say that I have the privilege of working with these 4 researchers on the regular, And it is truly amazing the work that's being done right here in our own backyard. Things that we underplay the magnificence and the impact of the research that's happening right here. And so it's great for you to have come out. And I have to say that you are leaving here changed people, because now you are ambassadors for this incredible research that's happening here. So thanks for taking the time to come and see us here today.